Welcome back to our next session here at ISNTD Festival, the event where we bring together all things creative to take a closer look and share all things around tropical diseases. We've just had an amazing session opening the day with lots of different projects, insights and advice shared about how to bring local issues to a global audience, all the way to a World NTD Day. And now in this session, we're going to unpack a little bit what goes on behind the scene and what's happening at the crossover between art and science, and with a particular focus on infectious and tropical diseases. We heard earlier on that as part of World NTD Day celebrations, there was a wide range and variety of events and projects, initiatives ranging from campaigns to advocacy at a political level, but also a song, and in fact an amazing exhibition called Reframing Neglect. And that is one of the things that we are going to be hearing more about today in our session. We'll also hear about some fantastic medical illustration with some live art that was created specifically for this session. And it will also be our pleasure to hear about the work of Arkitek Scientific, a studio represented here today by Beth, who's just joined us on screen. Welcome, Beth.
Hello.
Thank you so much for joining us at what is very early your side. Beth Anderson, your CEO at Arkitek Scientific. Welcome.
Thank you.
And to take us through this session, we'll also hear from Mahati Ramachandra. Welcome, Mahati.
Thank you.
You just graduated from the London School of Hygiene and Tropical Medicine in medical microbiology, and you are embarking in your career as a scientific illustrator. So you are literally embodying art and science. Thank you for being with us. Please excuse me. And to speak to us a little bit more in detail about the Reframing Neglect exhibition that was launched and put on at the time and around World NTD Day, but really brings together an exciting mix of artists working on tropical diseases and the many ways in which they can be communicated. It's my pleasure to welcome Gregory Porter. Hi, Gregory. Thank you for being here too. You're Senior Associate Director of Communications at the N Fund, and you'll be talking to us about Reframing Neglect, the fine art and documentary photography exhibition on NTDs with Omoregie Osakpolor. Welcome, Omoregie.
Thank you.
Hi. Hello. And you are a documentary photographer and filmmaker. So an amazing session ahead of us. Thank you so much for being here. And without any further delay, I'm going to hand over the floor. We have 90 minutes to kind of unpack and understand and learn from you yourselves about what is the best way that we can share science, share complex scientific concepts through the lens of art. And so without any further delay, I'll hand over to Mahati to share some of your work in this field. Thank you for being with us and welcome.
Thank you, Marian. I will just start my, oh, okay. So hello, good afternoon or morning. My name is Mahati Ramachandra, and I recently finished my master's in medical microbiology at LSHTM. While my background has mostly been in scientific study and scientific research, I have been very passionate about scientific illustration and science art over the past couple of years. And so with this presentation, I hope to showcase some of the work that I've done in the past. And this space is specifically one that I've had the opportunity to collaborate with other artists. And I think it has been such an inspiring journey, such an exciting one, because I think the greatest thing about being a part of scientific illustrations is being able to be inspired by other scientists and other artists so that you can learn more and just share the aim of being able to communicate scientific concepts through artwork. And so I hope to showcase some of the collaborations that I've done in the past with other scientists and other artists. And so with that, I just want to start with, oh, sorry. Yes. So my introduction to scientific art began in 2020 when I was doing my undergrad in Ashoka University, Delhi, India. So at the time, I was pursuing my BSc in biology. However, I had one particular professor who kind of knew that I was really interested in art and science, and he was the one that sort of told me that I could combine the two and that there was an entire field of scientific art and illustration for me to explore. And so alongside myself, 3 other students who are my friends and who are also doing their BSc in biology, we came together and we started this initiative we called Artiverse. So it was a science, art, and communication initiative. And our aim with this club was to essentially communicate scientific concepts in a way that was accessible to the general audience. And we primarily wanted to do this through visuals, as all of us had the same interest of enjoying art and science. And so we wanted to merge these two together to be able to communicate scientific concepts to a general audience. And so one of the biggest events that we had when we started this club was an exhibition. And so a lot of the pieces that you see in this slide were part of that exhibition. And the aim of it was to showcase the research that was being conducted at our university. And so, for example, on the complete right-hand side, I illustrated a piece that I titled The Circle of Worm, and it was to illustrate research that was being done where C. elegans was being used as a model organism to understand the genetics of rare genetic disorders and pathogenesis of other diseases. And similarly, the piece on the left-hand side with the bat and the DNA, it was to reflect research that was being done on studying genomics in bats. And so a lot of the art pieces that we did was to sort of reflect work that was already being done. And I think this experience was amazing because it involved us having to interact with so many researchers in the field, learning about their work. And I think the biggest challenge was trying to be able to communicate science, but at the same time, be creative about it. And so it was a compromise between being creative, but also ensuring a certain degree of accuracy. And I guess that's a certain compromise that you have to make as a scientific illustrator, knowing how creative you can be, but also ensuring that what you're communicating is accurate enough for it to be the right scientific information that you're conveying. And so figuring out that balance was definitely a challenge, but it was something that I was so grateful to be able to learn. And the team that I worked with, Laurie, Ameya, and Varshini, it was such a great group of people. It was really inspiring to be with other artists and to be inspired by each other and help each other out. And so these were some of the pieces that we had made. But alongside the exhibition, we had also created art in various different formats and in various different ways for different reasons. And so, for example, we had also created merchandise where we sold postcards and stickers conveying certain scientific information. And the aim of this was to simply make science fun because we wanted to allow almost anyone to be able to consume scientific information. We wanted it not just to be inclusive to people who are scientists, but also for non-scientists to be able to consume scientific matter. And so that's why we try to combine scientific information with a certain degree of playfulness to be able to make it more fun for almost anybody to consume it. And so we had stickers like mitochondria instead of mitochondria to just play on words. And we also had things like RBC float, where there was a little oxygen molecule that was lounging in an RBC float. And so we sold a lot of things in that manner. And it was a really great experience because in the process of selling that merchandise, we got to explain a lot of what we were selling. And it was this really fun interaction between us and people who are not scientists. And it was this beautiful space to be able to share scientific information and appreciate it together. And so I would walk around college and I would see anthropologists or even people studying other subjects just rocking a little mitochondria sticker on their backpack or on their laptop. And it was just such a beautiful thing to be able to see almost anybody appreciating science. And that's what I hope to do with scientific illustration. And we also had done a lot of commissions. So we would draw diagrams for certain researchers. And in the slide, I have included some posters that we made for people in our university because they wanted to advertise PhD programs. And I think this experience, it really taught me that visuals really influence the way that scientific information is consumed, because as a visual learner myself, I don't take in information too well if it's just written or if it's audio, but when it's accompanied by visuals is when I'm able to take it the best. And I just think that visuals is so impactful because it's so inclusive. It makes a lot of the information accessible. And so you can convey so much with visuals. And I think I gained such a huge appreciation for it through this club and this initiative. And so I'm extremely grateful for this opportunity and for being able to do it. And once I completed my bachelor's, I then moved to London to do my master's in medical microbiology. But alongside that, I got this really wonderful opportunity to produce art for my university. So they wanted to put artwork in their classrooms as part of just putting artwork in their rooms, which in with is such a great initiative on their part. And so I created a bunch of pieces for them. And since I had been making all this artwork, I just wanted to have an exhibition at the university as well. And it was just such a great space to have so many scientists, so many people from different disciplines coming together in one room, appreciating art, appreciating science. And it was just such a great environment to be in. And a lot of the pieces that I created were related to different scientific concepts. So for example, the snail that you see in the middle, it denotes this particular parasite, Leucochloridium paradoxum. And when it infects snails, it causes pulsating bands in their eye stalks. And so I took that concept and I wanted to reimagine it in my own way. And I produced this illustration. And similarly, I produced illustrations related to the malarial life cycle, coral microbiome, and things like that. And alongside illustrations, I also was able to put a mural on one of the classroom walls. And this mural was not just done by myself, it was done by other painters as well, who are also researchers. And again, that was just such a beautiful space to be in because we were all from different fields. We all had such different art styles, and we came together to produce one piece of art that was on a classroom wall. And so the particular artwork, I mean, the image might be a bit small, but it essentially denotes this universe of microbes within us. And as a microbiologist, I really liked that concept, so I designed something around it. And yeah, I just think the idea of a mural was amazing as well because it kind of introduces this idea of passive learning and passive appreciation for science while you are in a classroom taking in scientific matter from your teachers or professors. You also have this, you're also surrounded by art and science that you're passively taking in. And I think that concept in itself is really cool. And I really appreciate my university for encouraging this and for giving me the opportunity to do it. And so this exhibition was one of the greatest things that I got to do, and I'm so grateful for it. And as part of the exhibition, I had done a series with another researcher. And so this researcher is Dr. Archie Khan, who takes fluorescent images. Her research revolves around studying T. cruzi infection and how that infection progresses in Chagas disease. And I think her research is so important. It's so impactful and influential. And as part of her research, she takes a lot of fluorescent microscopy images. And so the coolest thing about her is that she loves to incorporate artistic intention into her microscopy images, where she loves to play around with color and different channels to produce these beautiful images. And so when she reached out to me, I really wanted to collaborate with her. And so I took her images and I included my drawings into it. And together we created this piece of art that we made together. And it was just such a unique experience. And it was a really great thing to have been able to have this interaction with her. And so, for example, this particular art piece, the first two images are fluorescent microscopy images of organoids. So she particularly studies T. cruzi infection in gut enteric systems. And so she grows her organoids, gut organoids, to study this. And so she took images of those, and I then took those images and I drew different things onto it, like villi and gut organoid tissues, to be able to sort of drive home the message of using organoids in scientific research. And similarly, we did another artwork where she had images of the gut nervous system that had been damaged due to T. cruzi infection. And so I took that image and I drew around it T. cruzi parasites circulating around these nerves and little eggs around here and there, because I wanted to sort of highlight this landscape, this parasitic landscape. And so it became this collaboration where we fused real life images and experiments with artistic renditions of understanding parasitic infection to produce this image that conveyed a message of infection and how disastrous, I guess, it can be. And so this whole series that we created together was one that I will cherish forever. And I'm very grateful to ArchiCon for letting me use her images and for creating this artwork with me. And lastly, my latest work involves creating a dengue infographic, a 3-part dengue infographic. My aim with this was that I wanted to be able to convey basic information about dengue so that anyone, regardless of what background they have, are able to understand what exactly dengue is, how do you get it, how can you prevent it, and if you do get it, then how can you treat it. And so this experience really taught me that I had to be very careful with the kind of language I was using, because as a scientist myself, I didn't realize it, but I was using very heavy jargon. And when I showed it to my friends or my family, I realized that a lot of the words that I was using was not very understandable by just anybody. And so this whole process required me to learn how to simplify this information, but to a point where I still retain the message of what I'm trying to convey. And similarly, even using the images, I had to think a lot about how I would place my images, what exactly I would showcase with my images, how complex or simple I would want them to be able to communicate that particular disease. And so it was really fun. I really enjoyed making this infographic, and I'm sure you can't really see the text that's on it, but that's okay, because myself and another intern at ISNTD, Rachel, together we have made a video where I have done a little live drawing of a lot of the images that you see here, and it's accompanied by a voiceover where Rachel explains about dengue, about how you get it, how to treat it, and how to prevent it. And so I hope you enjoyed that video. But with that, I finished my presentation. Thank you so much for being a part of it, for coming here. And I just want to say that it's an honor to be able to be in a panel of artists who are so accomplished and so talented. I think that it's inspiring to be able to be to share a space with people who have created such beautiful things. And so I just want to thank you, and thank Marian especially for giving me this opportunity. If you would like to view any of the artwork that I created or want to see more, you can look at my portfolio at behance.net/Mahati Ramachandra. But yes, thank you so much, and that is it.
Thank you very much, Mahati. I think everyone really enjoyed that. Ugo in the chat wrote, visuals really influence the way any kind of information is received, and highlights the hilarity with which you've shared scientific information is impressive. And indeed, that is everything that's needed to capture the attention and really draw interest, whether it be to a field or a specific challenge or piece of research. So it's been wonderful kind of following your journey through this through this world, and we look forward to hearing a lot more from you. And we will play the dengue animation. So at the end of this session, once we've seen all the wonderful projects that our next speakers are going to share with us, and we have a short discussion, then we will be playing videos. So please stay tuned for that. And so without any further delay, another incredible example of art and tropical diseases coming together is in this Reframing Neglect exhibition that is touring the world, actually. So I hope you will have a chance to catch it. But in any case, here's a wonderful introduction to that. I'll now hand over to you, Greg Porter, and then we will hear from Omoregie Osakpolor, one of the artists who's come into this exhibition. And with that, I will start the slides as well. There we go. Okay, Greg, over to you. We can hear you, albeit very quietly, but I think if I stop speaking and everyone turns up their volume, then we should be fine. Thanks for joining us.
Great. Well, thank you so much for having me here. I'm going to speak just for a few minutes, and then I'll turn it over to one of the artists who's in the collection. I'm just going to try to give a little bit of a background to how this collection has started. So the End Fund started back in 2012, and we're a collaborative philanthropic fund that focuses on NTDs. So what we really do is help get the private capital to our partners who do NTD programming. And it gives us the ability to work with a large, wide range of partners, from very small local NGOs to WHO and large INGOs. And that kind of gives us a pretty unique perspective to see the entire spectrum of where NTD programming happens. And it allows us as a communications team to also take this more holistic approach and not needing to focus just on the daily MDA administration part of MDAs. So being an organization that started back in 2012, it started with a handful of people out of an office in New York, and has grown substantially since then. And with that growth, it has also globalized. So back in 2012, the main way that we did communications was a team would travel from New York with a photographer, a videographer, and would capture stories. Closer to 2018, we began to flip that process on its head, and we tried to find storytellers who were more proximate to the stories that we wanted to tell, which is what led to this project, Reframing Neglect. We commissioned Ida Malune, who's a world-renowned photographer, to work on a series of both documentary and fine art photography that looks at the issue of NTDs. And what it was supposed to do is bring a fresh new lens to NTD branding. Because NTDs, while it's a program that treats nearly 1 billion people a year, it still has a branding problem, in which every time that I explain what I do for a living, what I work on, I have to go back and explain first what an NTD is. So we wanted to find a way of commissioning photographers to take a new approach to this and hopefully find a way to bring it to a larger audience. So Ida then went out and found 6 other photographers in 6 different countries, so 7 photographers total, who each took their unique approach to looking at this photography. And we can start to kind of go through them now. So this is all the 7 photographers and the countries that they worked out of. So Ida, who coordinated all of the work, she took more of a fine art photography lens to the approach. And her work really focuses on the intersection of issues of NTDs, of education and stigma. And it's really led to a lot of eye-catching photographs. It's the ones from the work that most people will stop and look at. This is Meseret, who worked out of Ethiopia. And her work also really looked at the connection of NTDs with women and girls. And so the impact that we've seen of the artwork so far is it has really toured around the world. So it's had exhibits in New York, London, Milan, And this year we're hoping to, it's in Kigali as well. And this year we're hoping for it to be in Nairobi and Geneva for the WHA. And we've estimated that almost 3 million people worldwide have seen the exhibits because they've gone in places like small gallery spaces, but also in public spaces, specifically high traffic areas in New York City. So it really has been a project that not only for us has it opened up doors, but people have come to us asking to put this exhibit on display. So I'll kind of just go through the other photographs, and then we'll get to Omoregie's photographs, and he can kind of explain his process as he went through. So just to give Omoregie an introduction here, he is a Nigerian photographer and filmmaker. We've worked with him now on several projects, even outside of this one, and his work is fantastic. For this project, he took a documentary approach that looked at the lymphatic filariasis program in Nigeria. Outside of this, his work has also been featured on CNN Africa, BBC, Quartz, and Al Jazeera. His short film, Gray, won the Fashola Photography Foundation Prize, and he was nominated for the George Prize for Photography at the Future Africa Awards in 2017. And I'll hand it over to him to speak a little bit more about his work here. Omoregie, are you there?
Can you hear me?
Yep.
All right, so let's get going. Hello everyone. My name is Omoregie Osakpolor. An artist, a visual artist from Nigeria. I work with photography, film, and most recently virtual reality and augmented reality. And my work focuses on social justice and advocacy, because I so much believe in the power of art to bring about social consciousness, and that's what basically influences the kind of work I create. And for this particular project to the edge and out, when Aida Mulune, someone that I actually respect so much, reached out to me sometime in 2021, and she told me about the project, and I was super pumped for it. For me, that was the first time, I'm going to be honest, that was the first time I was hearing about like NTDs. Yes, I used to see them on like I've seen them before. I've seen like NTDs patient before, but I didn't get to know much about it. And when I started my research, I found out that Nigeria is actually one of the places that's actually hardest hit when it comes to like NTDs, especially LF and river blindness. And I was really shocked and ashamed of myself too for not actually knowing these things. But then I've got to realize that, right, that despite the impact of NTDs on like low income areas and all that, it hasn't been given much attention. People don't know about it and all that. So for me, I decided to take a documentary approach to my project and look at the health workers that are working in the field, doing the work. Secondly, on the survivors of NTDs and the organizations working with end funds to eradicate NTDs. So I decided to take that approach because I so much believe in documentation of the ordinary people, especially health workers. You know, more often than not, when we talk about soldiers, people that have actually done great things, and when there's a particular issue and the issue over the years is now like solved, the people who were on the field, who did the work, are often not remembered. You know, so for me, I decided to point my lens on these people. So I photographed in Gombe. Gombe is in northern Nigeria. I photographed in 3 local governments: Zambok, Danikoa, and Duku. So this is the hospital, like hospital in Zambok, where AME Foundation, in partnership with NFonds, carry out free surgeries for LF patients, LF, hydrocell, elephantiasis, and all the patients for free. This is hydrocell patients waiting to be operated in at the hospital. Every now and then, when you go there, you see hundreds of these men waiting to be operated for free. This is an operating room. An hydrocell patient is being operated on by Dr. Gideon. Dr. Gideon is one of the doctors that has dedicated them their lives and time to partner with foundations like Dame Foundation and NFonds to make sure they help in eradicating LF from their communities. Is Dr. Gideon. This is a village in Zambuk, not too far from the primary health center, where I went to meet with a patient who, for a long time, was suffering from elephantiasis. He didn't actually know what was happening to him. They thought it was some spiritual attack. And so usually there are volunteers that usually go into these villages to talk to these people, and they're usually like people that they know. They talk to these locals and tell them, okay, what is actually wrong with them is not any kind of spiritual attack. It's a medical condition that could be treated. So they go into these communities, they introduce them. When they talk to these locals, then these locals will now accept to take the medication or even go to the health centers to be taken care of. And this is one of them, Aisha too. Aisha too is a volunteer and a community member in Zambuk. What she does is she goes to the different villages looking for people that are suffering from any kind of LF NTDs, especially LF, like hydrocell and elephantiasis. And this is Gani Abubakar. Gani Abubakar is a farmer. For years, he couldn't go to farm when he contacted elephantiasis. His leg became swollen and he couldn't do anything. The work he used to do, like he just stopped farming, he stopped rearing his cows and all that. So when IME Foundation got to the community through the help of Aisha too, he started his treatment. And after a while, the leg started, the swollen leg started reducing. And you can see here, he's actually started working and he has resumed his farming activities gradually. This is another local government in Gombe. It's called Duku. This is the primary health center. And this is one of those days. They usually treat they carry out surgeries on trachoma. So like Aisha too, there are other community members, volunteers that go into these communities to talk to the locals that the process is safe and that they could actually come and get it for free. So here they come to this primary health center and they examine them, and those that are ready for surgeries are taken to surgeries, all done for free by the IME Foundation through the NFond. This is Aisha too. She had trachoma. This was before a surgery. At a point, she basically did not know. Like in this part of the world, more often than not, when things like this happen, the people don't actually really know the cause. So it is ascribed to some supernatural forces being responsible for it. So when Aisha too, she's a tailor, and when she had trachoma, she couldn't do her work anymore. She couldn't even sew until, of course, one of the volunteers went to her and then explained to her what was happening and told her how she could be cured. So she was here at the health center here in Duku. This was just before a surgery was done. This is the health workers carrying out surgery on trachoma patients. And this is Danikowa Dam. In this dam here, for a very long time in Danikowa, the community members at some point they were going blind, and they didn't really know what was actually like the cause of their blindness. And this is like the only source of water, the major source of water in the community. And they all come here to fish and to get water, not knowing that this particular dam was responsible for their blindness. And at the very dam, they get beaten by the black flies, and over a period of time, they keep coming back, and then over a period of time, they go blind. So river blindness is common in Danikowa as a result of the black flies at the bank of this dam. And this is Adamu Musa. Adamu, like Aisha too, is also a volunteer. He is a farmer too and a member of the community, but he has decided to give his time to help MF Foundation and local organizations helping to bring free treatment to his people. He is one of the fly catchers. So what they do is they go to the bank. So there's a way they've been taught to catch these flies for research purpose. So this is Adamu's fingers, of course, with the black fly that causes the river blindness. And this is Adama, one of the patients of river blindness. For a long time, when he became blind, he stopped his agricultural work, his farming and cattle rearing, and he couldn't work anymore. And at some point, he was just all at home until MF Foundation got to the community, and they started MF Foundation through, of course, N funds got to the community, and they opened up a skill acquisition center where they learn rope making, mat making, and all stuff like that. So he does that now, and he's able to like basically do that to make ends meet. He sells at the local markets and use that to support himself. This is Zuaira Yusuf. Zuaira Yusuf, like Aisha and Adamu, also like are volunteers, and she helps in distributing Mexican in a community in Duku. So these are some patients of he had trachoma, but he had trachoma, but after his surgery, he could see well now. She had trachoma too, and on the right here, she is suffering from elephantiasis, but as you can see from the photographs, she's the leg is actually like reducing. Before now, it was so big that she couldn't do anything, and it was all pain and all that. All right, so that's it for me. Like I said earlier, why photographing these people? Because one thing I believe about photography is collaboration. Photography is a collaborative art process where you as a photographer gets to a particular place and you do not just take the photograph, you take the photograph in collaboration with the people you're photographing. So for me, one thing that always comes first as an African photographer working in Africa is photographing my subject, especially people that are suffering from diseases like this, is to photograph them with dignity, So they collaborate with me in my creative process. First, I ask them if you're comfortable with me photographing you in this way. That's one. If you're comfortable, if you're not comfortable, how would you want me to photograph you? Sometimes some will say, I don't think I want to be photographed, and I respect that. So for me, like photographing my subject with so much dignity is it's so important for me. And like you've seen in this portrait here, and it's what about like more collaborative, like a give and take exchange of ideas. So that's it for me. Thank you.
Thank thank you so much, Greg, and thank you so much, Omoregie. I don't know if at this point, Greg, you wanted to add anything, but from our side, it's been absolutely amazing to see your initiative, but also your images. I think you couldn't have phrased it better than how you concluded, Omoregie, in this real collaborative process. As Greg said, we do all find ourselves sometimes having to explain quite in depth what we do and what these diseases are, what actually unifies them, and having these images really is what will stay with people. So an amazing initiative. Thank you so much. Before we kind of come back together and ask a few questions, because we definitely want to know more about where this is going and any advice you have for others who are really trying to work with improving the advocacy, improving the awareness on the diseases they work in. And there's been lots of claps in the chat as well. Before we turn to that, I'll hand over to our third speaker for the session, Beth Anderson. Beth, thank you so much for joining us at what is a very early hour for you. We're very excited to discover more of your work at Arkitek Scientific. You are bringing scientific concepts together with really cutting-edge animations and helping the scientists not just through an artistic lens, but really to share these concepts in a much more engageable way. So Beth, lovely to have you here. I hope you can hear me. I hope you're still with us. I know you've been traveling, so your connection might be up and down. Your camera and microphone are off, so just to let you know, we can't see you at the moment from our side, but if you are able to reconnect and rejoin, we would love to hear all about Arkitek. Yes, we got you.
Hi there.
How are you?
I'm fine. It is a bit early here, and I apologize because I'm traveling and I'm out in the country. So I haven't been able to tunnel into my network to retrieve some of the things I wanted to use. But I just wanted to give an overview of how we started briefly, why we started, and the things that we have been working on over the past nearly 29 years. So we've been in this for quite a while. I grew up in Oak Ridge, Tennessee, which was part of the Manhattan Project in World War II. And the only real interesting thing about that is the fact that I thought until I left home that everybody in the world was a scientist. I truly did. And it took me quite a while to realize that not only was not everyone in the world a scientist, but that many people didn't care. And that struck me as extremely strange, because even though I did not go into formal scientific education, I was fascinated by it, and I couldn't understand how anyone couldn't see that this wasn't an integral part of life. And so I went far afield, went into the artistic world, did ballet for a while, did rock and roll music for a while, and finally thought, I think I need to do something serious. So I went back, got a degree in 3D animation, and started this company. When we began this company, very few people were actually doing this outside of universities, partly because the software and the hardware were extremely expensive. But we landed right at the moment when that software and hardware became a lot more viable to get. And so we began in 1995. In 2003, we got the opportunity to start working with Nature in London to develop various animations for them. And these were mostly very basic science, not about any specific research that anyone was doing, but basic science of what was already known. And I wish I could have tunneled into my network, because we had done an animation, 3 animations on Listeria, Legionella, and tuberculosis, and their method of entrance into the body and being able to evade immunological defenses. And if if you would like to allow me to put those up on the net, once I tunnel into my network and get them up on the net, I can send you a link to them and you can take a look at them, because they're not actually up anywhere other than on Nature's site right now. It's interesting to me, I apologize, getting over a cold. It's interesting to me that art showed up in the human experience before agriculture. So people were painting things on walls to explain or detail or memorialize things that they had encountered in the real world long before they were growing crops. So it seems to me that art is so intensely fundamental to the human experience, and it's one of the integral ways that we share information. So for me, I don't understand why it is that people think that scientific visualization is such a far-flung thing. And thankfully, it's not now. Thankfully, it's come into its own. People like the other three presenters are showing, obviously, that this is something that is a going concern and that people resonate with. They immediately grasp what the situation is, what the problem is. It's also interesting to me that a little over half of the human brain is given over to visual synthesis. So that's a lot of firepower aimed at a specific thing. So visual transference of information turns out to be pretty much the fundamental way that we move information back and forth between us. I would say that most of the work that we have done over the last 29 years revolves around immunology, basic immunology, which obviously moved forward as the field moves forward. I'm going to try and share my screen, and I hope that I've got a good enough connection for you to be able to see. And I don't know if I'm going to be able to show actual animations. Can you all see this? I certainly hope you can.
Yes, absolutely. That's come up really clearly. Thank you, Beth.
You're welcome. And I apologize because much of this stuff is outside the scope of neglected infectious diseases because we attack the problem. That's one of the things that we did for nature, and you can find that on their site, and I'll send you the link to that afterwards. But much of the work that we do revolves around showing how the immune system reacts to various stimuli, not necessarily from the perspective of a specific disease and what the mechanism of entrance and the mechanism of action of that pathogen is, although we have done work like that. This is something that we had done for fusion reactor, so has no bearing on what we're talking about here. But I would just say that to me, it's always been very interesting when we are assigned a project that may have very detailed, specific information about specific immunological pathways, protein-to-protein interactions, etc., that may be very complex. Even though these may have been designed for science-to-science, lab-to-lab communication, given if you design the script so that it doesn't use so many scientific buzzwords, but uses something that's a little more general, the general public can get this. This is not something that has to necessarily be dumbed down for them. They can understand this if the terminology that's used is terminology that they're familiar with, or if it's explained to them. So I would think that it's in trying to relay the information about your specific field, your specific work, it's important to realize that you need to show people not only what the problem is, you need to show them the ramifications of what that problem can breed later on. And you need to show them if there's any ongoing work that may be able to eradicate or mitigate that particular disease state, to show people that as well. Because I think that there are so many instances where there are terrible things happening in the world, and many people are only seeing all of the bad, and they're not seeing any particular solutions. And I know that many of these diseases do not as yet have solutions, but there is research that's ongoing. And that's what you're trying to convey, is the fact that there is ongoing research, that it is moving forward, that here are the steps that we've taken so far, and here's the projected potential that it may happen somewhere in the future that this particular disease state gets eradicated. So with that, I'm going to turn it over, because unfortunately I don't really have any other visual information to show you that's applicable at the moment, and I apologize for that. But I'm more than happy to speak with people afterwards or answer any questions that you have. So thank you.
Wow. Thank you so very much, Beth. It was really important for us to have you as part of this panel. You mentioned your journey since 1995, and the technology has changed so much, even now, year to year or every 6 months. And having your approach, which is really very cutting edge, very modern, comes in contrast with some of the other things that we've had the pleasure of having at this ISNTD Festival, which may be a very simple board game, or it kind of fills the spectrum of all these ways in which we need to visualize and share information about diseases or scientific research as part of this large ecosystem. So thank you so much. We did get an amazing insight into what your studio does, so that was wonderful. And none of the technical things we may have feared actually happened, so it was all good. Thank you so much. We did it.
Thank you.
Well, a big thank you to our 4 presenters. And at this point, perhaps if I could invite you all to come back on screen. I know the audience has absolutely loved this session, and so have I. My only is kind of the only thing I feel sorry about is that the pandemic got in the way of this event that used to be in person and was a real festival, a real joy and collection of lots of different things happening, from one-man show in one room to a workshop, a creative writing workshop in another, etc. But we're still here, and I suppose one thing that we would love to ask all of you, and this is something, it's a theme that's kind of permeated throughout the festival overall, is what would you like to say to scientists in terms of really encouraging this field to approach and embrace and embed artistic approaches to their science, to their research, maybe even to their advocacy work and causes, just to really, like, some of you are artists and others have put on an exhibition, and so what have you learned from embedding art in science that scientists should really know and really use a lot more? I don't know if someone wants to go first, or...
I will.
Please, Beth.
I have always found, because there is always this intersection between the scientific community and the world at large, whether scientists know that or not, there are a number of people who are paying attention, and people are hungry for information. They need it. They need it to inform decisions. They need it to mitigate any fears or anxieties that they may have. And it's incumbent on the scientists to reach out. And I realize, everyone who's running a lab or doing research, it's a full-time endeavor. but it makes an awful lot of difference to people in the wider world if they are contacted by the scientific community and shown in the ways that everybody has shown today that there is a link between science and health. That sometimes these things in the public's eye seem to be two sort of separate things. They're not to me, but I think a lot of people do think that. They think of science as this completely enclosed environment that has nothing to do with people in general. And that stereotype still persists, and it's got to be broken down, because people have to understand about what's going on in research, because they have to be informed, because they vote on things like that. And so in the United States, the NIH, the National Institutes of Health, all of that funding, all of the appropriations for scientific endeavor, and likely worldwide in other bodies, that requires the public understanding what it is that they're doing and saying, yes, we want to fund the work that you have. So it's not only an idea of getting the concepts across about the scientific research, but it's having people understand that this is a political issue. People need to understand that this work is furthering human evolution. And as probably everybody has seen in the world, particularly in the United States, which I'm not proud of, is that there was a huge backlash against vaccines, for example, which I just don't understand at all. But it's because the public was not informed, or they were misinformed. And so it's not only that the scientific research is saving lives by coming up with new methodologies to deal with disease, but it's that people can die by not knowing about what research is being done.
Wow, there's a lot to unpack there, and that's absolutely right. It's interesting you mentioned the funders as well, because not only is there kind of lots of benefits and this moral imperative to make sure science gets shared, so to combat misinformation, as you said, very timely reminder as World Immunization Week is about to start, but also funders really are embedding that into their support, that science shouldn't just be done, but should also be shared. In fact, we have a funder on the call right now, so it'd be really interesting to hear your perspective. Although, Omoregie, I saw you were ready to jump in and on top of what Beth was saying, to add to that.
Yeah. In addition to like what Beth was saying, I think there's a need for scientists to reach out, and especially to like people like ourselves, like artists in general. There is stories are so powerful, and stories are powerful. For me, I have this strong belief that it is the kind of stories that we tell ourselves that inform the kind of people we become. When you throw numbers at people, sometimes it gets to a point where it begins to fly over their head, like it just fly over. Numbers most times go into the head, but stories go into the heart. And it is until you speak to the human heart that the human would move. Most times we don't act based on what we have on our head. We act based on how we feel, and it's natural, and that's how humans behave. So that's why for me, it's really, really necessary that scientists reach out. It becomes like a collaboration between what you're doing. This is what you've done. Okay, now I simplify it and inform the people through stories, and then it goes to their heart, and then hopefully they take action. So yeah, it's really quite important.
Absolutely. Greg, would you like to add to that?
Sure. I guess I would say that I think enthusiasm is infectious. So if there is something that a researcher is doing that they are enthusiastic about, a good story can be made of it. Oftentimes when we work on projects, we go to people who are enthusiastic about something, but they don't really think it's a big deal. And it can be something as small as community health workers distributing medicine and walking 10 kilometers in a day to get from house to house. And they're just like, yeah, we walk from house to house. But that there are stories in there that when people think what their work is mundane, it's anything but. And I think it's our job to help bridge that gap of what people think is just the everyday that they're doing, and connecting that with the broader picture.
That's such a great reminder indeed. We can sometimes get lost and forget what we're doing is actually incredible, and that story really highlights that. Thank you, good point. Mahati, you made that shift from science to art, so I guess you're one of the biggest advocates for embedding art far more in science. How can we persuade scientists?
I mean, I don't have much to add. I really loved what Omoregie had said about how we act from the heart and not from, like, how we primarily act from our heart. I really loved that line, and it's true, because I think that art brings a certain humanness to science, because it's very easy to sort of conduct science in a very impersonal way, because when we're dealing with diseases, we see it as, okay, this is the disease, these are the symptoms, this and this, but then when you bring art into it, you kind of see the nuances with it. You see how it impacts different populations, how it impacts, you kind of see what exactly is happening. And I think that that's really important when you're in terms of motivation for science, and to know, and I think especially when we're talking about finding treatments or public health interventions or things like that, I think it's really important to know that humanness and to be connected in that sense. And I think that art is really helpful in that way, because you have that proper motivation to drive your treatment and drive your intervention in a way that helps the public, and not just in a way that it's done impersonally. So, yeah.
Mm-hmm.
Thank you, Mahati. And that really highlights an important point that Rod Dillon was also echoing in the chat. Hello, Rod, a fellow ISNTD Festival presenter and participant. It's nice to see you here. Rod was just saying there needs to be more funding for artists to be embedded in research labs. And I suppose that is a question. How can we increase funding for artistic projects and colleagues within research efforts, within research labs even? Beth, sure.
Well, I can only speak for the US. It's very difficult to get that sort of thing injected into research funding on a governmental level here. It can be done, but it takes a very long time. It seems to me that there needs to be some sort of public-private partnership. There are a number of foundations that are science-forward foundations, like the Annenberg Foundation, the Alfred P. Sloan Foundation, the Lasker Foundation, etc., that are, their mandate is to promote scientific literacy and scientific understanding, but they're not specifically aligned with any ongoing research lab in an ongoing basis. They may do, one particular highlight, one highlight. That's a really thorny question, because the money's got to come from somewhere. It can't come from the labs themselves, because they require that money in order to actually do the research. So they need to be able to get the hardware, the software, and the personnel to be able to do it. So I think it comes down to not-for-profit foundations that think that this is an important thing to push forward.
Thank you. Would anyone else like to add to that?
Yeah, sure, maybe. I think for a lot of these projects, a lot of institutions, the money exists. I think it's actually more on the people who make the decision about where the money goes to invest in more creative elements versus a standard approach of communications. Because, for example, as an NGO working on NTDs, you have a certain imperative to capture photos of things like mass drug illustrations. So it's hard to make the decision always to go with something that's more creative, that you don't understand what the payoff will be down the line. But it is a decision that's being made. And similar to research institutions, most research institutions have communications budgets, and they're putting that money somewhere. But it's probably more of the standard approach of disseminating information. So it's a little bit, I mean, I understand why organizations and people make these decisions. But I think that it is possible within the kind of scope of budgets that we have as organizations. It's just on us to kind of take the risk and give the artists the flexibility to really work on these subjects, because that's what we found is incredibly key too. You find the right artists to work on a project, and you let them do the interpretation, and then you help with kind of the facts and the research behind it. But really allowing artists to do their work is the most impactful from us.
Wonderful. Omoregie, you are the artist, and Mahati as well. How easy do you find it to connect to scientific projects or public health bodies, groups?
I don't. Okay. It's really difficult. Anyways, it's difficult to like access funds and or even get funds, right? And so most times, not until like we work in collaborations like this with organizations like the End Funds, and it's actually like non-existent, especially from where I work from and where I live. It's actually like non-existent, you know. And yeah, I can only speak from about where I know and where I'm from. Yeah.
Yeah, that's wonderful. But what about you, Mahati? Because you were really involved in the London School, and you've had some very close collaborations.
I think I was quite fortunate in that sense. I think just through a lot of conversation and dialogue while I was doing my dissertation is when I had a lot of conversations with people working in the labs and things like that, is where I got these opportunities to collaborate with people. And I think I think also the fact that there was this online forum where you could post your interests and things like that is where I got all of the interest. So I had put up a post about how I was doing this project, and if anybody was interested, they could come and join. So the fact that I had that network is what made it possible for me to connect with all these different scientists and be able to work with them. But I'm not sure how easy it would be outside of a university like that. I think it would be quite difficult, but yeah, I think within networks, it's quite useful.
But this is everyone's opportunity to follow up with two brilliant artists who are doing this work and keep expanding this work.
Absolutely, and we hope that somehow it's now in its 8th year of the ISNTD Festival. Little by little, we're helping to bring these two worlds together. We do know there's been some amazing collaborations that have come out of the festival over the past year, so that's been great. But that was really interesting, Greg, that you reminded us that there are funds available, there are these resources put aside, and working on the journalism panel that's coming up later on today, one thing that really came about was there are more and more organizations who are trying to do exactly that, match scientists and journalists, because the journalists need the content. They want a good connection to the right scientists for their stories, and the scientists are also looking to share their work. And a number of these really great science journalism, science communication organizations are coming up to facilitate that. And so maybe this will be our last question, and sort of turning to the future. Coming from your various perspectives, do you feel that there could be room to improve just that, as Mahati said, having a forum for artists, for photographers, musicians? We had Derek Mpofo earlier in the day who created the World NTD Day song, for example, and that was an amazing piece of very successful engagement around NTDs. So who's missing to bring these pieces closer together? What could we do more of, turning to the future?
More festivals.
More festivals.
More festivals, yes. More publicly promoted festivals that are in venues that might not normally have this sort of thing. Museums, science centers are wonderful. Science centers are great repositories of information and purveyors of information, but other places, art galleries that don't normally do this sort of thing, do something that is much more science-centric. Festivals are wonderful because I realize that they're difficult to put on. They require a lot of energy, but they are events. They're not something that somebody just sort of gets used to. Oh yeah, I'll go to that. It's an event that's time dependent, and people get interested in going to it. So I would say festivals are a wonderful, wonderful way to do this.
Well, that was heard loud and clear. We were hoping to go back to an in-person event this year, but that was not possible due to some internal issues. But, I have heard someone come a day early home from their honeymoon, so they wouldn't miss the ISNTD Festival. So I think people like it. I haven't heard of something similar, at least in the field tropical diseases. So we will try our best for next year. We hope to see everyone there in person. It'd be lovely to meet face to face. Any other suggestions?
I don't know if this is a suggestion, but I think the work that the Wellcome collection is doing is quite amazing, because it really promotes using art as a way to promote scientific information. And just walking through that exhibit, it's just so inspiring to see how much they promote and how much they value using art as a way. And not just, and by art, I mean any form of art. It can be visual art or even music and things like that. So just having institutions like that really makes such a huge difference, because I think those are ways that you can get funding. Because I think, as Greg had mentioned, the money is there, but it's just not going into this. And I think one of the reasons, at least in my experience, is that maybe not a lot of people know what the power of visuals really are. And that has definitely been the case for me, because I know that there have been situations where there's no investment into art because you don't know what the power of it is. You don't know how much of an impact it can cause. And so I think just knowing what a useful tool it is the first step to actually getting people to then, invest in these kind of projects, because it's the people who know how influential visuals can be are the ones that push that forward, which is why, I got to be so fortunate with LSHTM, but that's just, I think, in my experience, people need to know what the power of visuals really are to be able to then push that forward.
Yeah. Mm-hmm. And a great suggestion by Rodilin here. Another route is to invite art students themselves to do short residencies in labs as part of their degree projects. This is being done in Fiocruz in Brazil. Also music venues with a DJ. Let's just throw it all together in a massive super festival. Mm-hmm. Omoregie and Greg, your you're coming from either the artist perspective, the funder's perspective, who could or how could we accelerate, facilitate the arts and the sciences meeting in practical terms?
I don't know if I have much more to add. I think just giving artists the resources that they need and the time they need to do impactful work, and the results will come after that.
Yeah.
Yeah. Yes, yeah, I actually don't have much to add. Actually, like I agree with the idea of the festival. Which is like, this is like my first time of hearing about this festival, and I was just imagining if it were to be like an in-person festival, where the scientists know that they're not really coming to, like, it's not work. It's about like a very relaxed mood, and we talk about like those things. We exchange ideas and all that. You meet people that, like, you meet artists that you would not actually ordinarily meet on a regular day. So I think, like, yeah, festivals, and yeah, and the lab thing, and of course I think the lab thing would have to come from, it has to be like, it's actually at the policy level, kind of, where like institutions make it, okay, at this point we would basically like invite artists to come to labs and all that. It's actually going to be at the policy level, and yeah, so that's just it.
Mm-hmm. Thank you so much. And I have to say, the N Fund specifically is always trailblazing in this arena, whether it be with this exhibition or other engagement projects. There's even been a book written by the former head of the N Fund. So just, yeah, a really great partner to engage with, to follow in this space. So it's being done right here. It's been really wonderful to meet the artists with your very different and varied range of medium and projects, Mahati, Omoregie, and Beth as well. We really look forward to seeing where this goes next. The momentum, the movement around communicating, particularly on global health, especially following the pandemic, but particularly on these 23 neglected diseases, is really gathering pace, and that's been very, very exciting. Steffi Lowe's adding the Science Gallery in London is also good with artistic science exhibitions. That's true, and there's also a really great group that brings together creative parties with scientific parties associated with them. That's a great suggestion. Thank you, Steffi. Well, if there are no more questions, and I think we've really spent a wonderful 90 minutes with our participants, I would love to keep the last 5 minutes to share the animation that Mahati and Rachel Matama worked on in preparation for this festival, just creating in a very live way an animation on dengue, and Rachel being the scientist, Mahati being the artist, so really embodying what we're trying to do during this event. For those who have to go, please feel free to disconnect. Also, our speakers, if you need to go, thank you. I'll draw this session to a close before we just play the video and some other films until our next session, which will start very shortly in about half an hour, and that will be more storytelling, but this time in a slightly more technical term, looking at the science and art of data visualization. So please do join us for that next session. Until then, a final big round of applause to our speakers. Thank you so much. We've learned a lot from you. Thank you to our audience, and hopefully see you very shortly in the next session as part of this festival, after we play our few films on this same screen. But in the meantime, all the best to everyone, and thank you again for your time. Thank you so much, and lovely to meet you all.
Hello and welcome. In this art and science blend, we will try to make the best use of digital art in a cranky voice to let the world know just a little bit more about dengue. Unveiling its dangers and discussing prevention, I'm your narrator, Rachel Mtama. Alongside a digital artist, Mahati Ramachandra, we invite you to explore the impact and prevention of this global health challenge as we bring this topic to life with exciting visuals and insightful commentary. Dengue is a viral infection caused by the dengue virus. This mandible tiny form of life, virus, is carried by an Aedes aegypti mosquito vector, breeding in stagnant water, and it's through these mosquito bites that the virus spreads. Dengue outbreaks are seasonal and reach their peak during and after the rainy seasons. Looking into the epidemiological numbers, every year, dengue impacts approximately 390 million people worldwide, and it's quite common in tropical and subtropical climates. This is largely because the mosquito vector thrives best in warm temperatures. Several factors over the years have led to dengue incidence increase, and these include climate change, rapid urbanization, and population growth. Some common symptoms of this disease include high fever, headaches, body aches, nausea, and rashes. The similarity of these symptoms to malaria has made diagnosis of this disease challenging, often leading to delayed treatment and increased transmission rates. Therefore, it is important to consult a healthcare profession for accurate diagnosis and treatment. Early detection can significantly improve outcomes and prevent complications. To minimize the spread of dengue, basic important means can be employed, and these include reducing mosquito exposure and ensuring early diagnosis and medical care to decrease fatalities. Let's dive deeper into the topic of severe dengue. Ever wondered what severe cases look like, what signs to watch for, and whether they can be managed effectively? In this segment, we'll examine how severe dengue develops, identify its key symptoms, and discuss the current treatments available. There are 4 flavivirus serotypes causing dengue, designated as dengue 1, 2, 3, and 4. The specific viral type associated to severe dengue varies from one region to another. Sadly, recovery from one serotype infection provides immunity against that particular virus only. However, an infection with any virus increases the risk of developing severe dengue in subsequent infection with different dengue virus. Severe dengue signs usually emerge 24 to 48 hours after the fever goes away. These include pain in the stomach, persistent vomiting, restlessness, fainting, rapid breathing, bleeding gums or nose, and presence of blood in vomit or stool. Dengue is a self-limiting illness, meaning that it resolves on its own. It is generally treated through supportive care, including plenty of rest, hydrating with enough fluid, use of painkillers to alleviate pain symptoms, and for prevention, the Vaxia vaccine approved by the FDA in 2019 is available for those who have dengue infection at least once. Mosquito control is the best means to minimize dengue spread. To do that, we should know the enemy we're dealing with. Starting from the very simple roots, how does the vector look like? The Aedes aegypti mosquitoes, notorious for spreading dengue, have a distinctive feature of white bands on their legs, making them very easy to spot. They are commonly found in cities where they've learned to thrive among people. Unlike some mosquitoes that are most active at dawn or dusk, Aedes aegypti is a daytime biter, posing a risk throughout the day. They are often found in shaded areas, can lay eggs in the smallest pools of stagnant water, from discarded tires to flower pots. Understanding these behaviors is crucial for effective prevention by eliminating standing water around homes and using protective measures to limit skin to mosquito exposure. Endingly, here are the preventive measures to help minimize dengue spread in the community. Getting rid of stagnant water, use of insecticides, mosquito repellents, wearing clothes that covers arms and legs, and use of mosquito nets when sleeping. Thank you for your attentiveness, and greater thanks to Marian Comparet, our internship coordinator, for the opportunity. This infographic can be found at Mahati BN's portfolio at the link available.